There's a lot of drug development ongoing to treat patients who have epithelial ovarian cancer, women that have epithelial ovarian cancer. New agents that we're incorporating actually into frontline therapy with the first chemotherapy, really with the hope of increasing the number of cures that we see, secondarily with the hope of prolonging the time until the disease comes back. And there's also really kind of a landslide of, it's not a good drug, there's really an avalanche of new drugs that are being developed specifically for epithelial ovarian cancer, and we currently have in clinical trials more for patients that have recurrent disease to see if there's signals of benefit. And so, for example, we've been talking about patients who have BRCA mutations, and there's a new class of drugs known as PARP inhibitors. PARP inhibitors are oral agents that for patients who carry a germline mutation in BRCA1 and 2, unfortunately that mutation allowed them to get a cancer, but that mutation is also a bit of an Achilles heel for that cancer when it comes to treating it with chemotherapy. It makes it more susceptible to chemotherapy, and PARP inhibitors kind of act in that same vein. They exploit that mutation to our advantage and help us treat the cancer. We're increasingly aware of the fact that these PARP inhibitors likely have benefit in patients who don't have a BRCA mutation, and we're able to identify those patients with increasing precision so that we can offer this therapy to those patients and then not expose patients who are less likely to get a benefit to any added risk. We're also starting to do combination clinical trials with PARP inhibitors and agents that try to stimulate your immune system. There's a whole field of drug development in kind of precision targeting or kind of creating chemotherapy smart bombs that direct chemotherapy directly into the tumor and not into your bone marrow and nerves, et cetera. So there are a number of fields where drug development is really increasing in speed and with new agents. So it's, I think, a time to be very hopeful as a patient. We're finally getting drugs designed just for ovary cancer and not kind of waiting for the leftovers from breast cancer and other cancers to trickle down to us. So there's lots of reasons to be optimistic now. PARP inhibitors are a relatively new class of drugs. They're all at this point oral agents, and depending on which PARP inhibitor we're talking about, they're either dosed twice a day or once a day. And how they work is that they target how a tumor fixes its DNA. So they block one of the proteins that's necessary for a cell to fix the DNA and keep on replicating. So every time, right now, just sitting there watching this video, all your cells in your body are dividing at various rates. And all of those divisions involve errors that we have this very wonderful and complex surveillance system to fix so that the replicated cells are normal and continue to propagate normal genetics. When you have a BRCA mutation, that surveillance system has an error in it, and so it makes it much more difficult for cells to appropriately fix their DNA. And then when you bring in a PARP inhibitor into that setting, it's sort of a two-hit. Now you have a cell that already struggles to fix its DNA and keep dividing, the cancer cell keep dividing and replicating and growing, which we don't want it to do. And you bring in an oral agent that blocks in a different way how the cell fixes its DNA, and often that's just too much for the cell to overcome, and it just kind of signals itself to die. And that's what we want to happen in a cancer cell, because we want them to realize they're no longer capable of living, and they just should mark themselves for self-death. And so that's really how PARP inhibitors work, in that they really prevent cells from continuing to divide and create viable offspring. Currently, we offer BRCA testing to all patients with epithelial ovarian cancer, and we use that information first to counsel family members to try and create previvors. But secondarily, it does increasingly inform some therapeutic or treatment options, most specifically related to the use of PARP inhibitors, which are oral agents that patients can take once or twice a day, depending on the agent, to target specifically that BRCA mutation that unfortunately places them at risk for cancer, but actually makes them more susceptible, their cancer more susceptible to treatment with agents such as PARP inhibitors that target how tumors fix their DNA, how they survive. And so if a tumor can't fix its DNA, it's much more apt to just die. And so we do see nice responses with use of PARP inhibitors in patients with a BRCA mutation. So the knowledge that a patient has a BRCA mutation will impact our decisions maybe to offer them a clinical trial, or certainly it sort of sets up a strategy for how you're going to treat that patient, keeping the availability of PARP inhibitors, available PARP inhibitors in mind, so that you line those patients up to get access to those drugs as soon as it's clinically needed and indicated.